Hello, this video is about the best practices of how to do meds through a G-tube. And I'm going to go a little bit out of order at first because we're actually doing my meds. One of the important things with meds that need to be crushed is to do so thoroughly. And then you have this med. Now you'll see that all of my meds are in separate med cups. This is because it's very important to keep meds separate from each other because they can not only interact with each other and cause more med interactions that are not necessarily safe, but they can also make each other not as effective if mixed together. And I get a lot of questions as to why I don't just mix them all in one syringe when they all go into one stomach. And the answer is because the syringe is so small and plastic and not movable that the meds interact more chemically inside the syringe altogether than they do when they're in your stomach. And with these meds, we always go med, water. So there's always water in between the meds, which is as close to taking a pill as possible at a time. Now, I'm also going to show you how we do the meds, and I'm going to hand my camera because I don't know how to do that with 3 hands. I have a AMT Mini 1 G-tube button, and this is the bolus to feed extension, and here is the water. It's very important to first flush your tube to make sure the placement is correct, and also to clean out the tube in case, especially if you're doing feedings through the same tube that you're doing meds through, and to just keep the tube from clogging, less possibility of that. And each doctor is going to recommend a different amount to flush. Always flush with about 50 cc's first, and then now we start with the meds. And I'm not going to tell you what they are because I don't want the whole world knowing that. So, we do 1 med at a time, and with meds that are pill, I add about 15 cc's of water to each after they've been crushed. Something about pills that's important for you to know is that you don't ever want to use time-released pills because then you crush them and they're no longer time-release. You want to use all immediate-release stuff, which usually means liquids or tablets. Liquid is better to not clog the tube, but tablets are sometimes the only thing available. The pills that come with the little balls inside, you don't ever want to crush those little balls because those are time-released. There was an article in the most recent Olay newsletter, and Olay is an organization that is for people that are tube-fed, and their website is www.olay.org, O-L-E-Y, and they had a recent article in their newsletter about how to do this, so I'm just demonstrating. I always wear gloves and have my nurse wear gloves because that's cleanliness. I think it's important that you wash your hands or wear gloves when you do this because it's, not a sterile procedure, but it does need to be clean. In between each med, we do about 15 cc's of water. I've heard some people do anywhere between 5 to 30 to 50. Really depends on what your stomach can hold, and mine can't hold much, and I get a lot of meds. So that's why we do it, and we go slow because otherwise I get sick. One of the things the article talked about was common errors that happen that tube feeders do with meds. They don't flush the tube before meds. They don't flush in between meds. or they put multiple meds together, or they crush extended release meds, or they don't dilute liquid meds. And I have seen some YouTube videos that make me want to cry, because it just makes me feel bad that people aren't taught how to do meds correctly and safely. And this is just a safe way of doing it because it prevents med interactions. It also is more makes it so that the meds do what they're supposed to do, and it gives, I don't know, it's just good, and there's a whole lot of reasons, and I can't remember them all. And you should check out Olay's website if you want to see more about this and read this article. I highly recommend it. And I'll finish up with a list of things that are recommended practices. Where did it go? There it is. Okay. Recommended practices include: do not add meds to formula. Oh, that's a big one, because if you add meds to your formula, you can not only clog your tube, but you can affect the way that the med is absorbed by the body, and that's not good, and you can affect how the formula works too. You want to use only immediate release formulas, which I already said, like liquid and tablets. Like, here goes a liquid right now. Look at that, straight live down the tube. And then you want to administer each med separately, and you want to dilute liquid meds that are really sticky to prevent clogging. And you want to flush after all of your meds too, so that there isn't any residuals in your tube, and then hook back up to feeds or unhook, and your tube is all clean and it's awesome. And if you have any questions, please ask. And thank you to my lovely nurse, whose hands you see. And see you guys next time.